Hello, I hope you're doing well today. Happy Thursday. My name is Dr. Kimberly Fortner, and I am a maternal fetal medicine provider, which means I take care of high-risk pregnancies. And I work here at UT Medical Center. We're so thankful for your time today and your interest and your enthusiasm. And we look forward to spending this next, however long you have to spend with us, 15, 30, or 45 minutes, talking about the COVID vaccine and pregnancy. So we'll try to answer your questions. We'll try to work through. Thank you to those of you who submitted questions in advance. And then we have teammates on board who are going to help me sort of hear what the next questions are, and we'll do our best to talk through them. Our purpose today is really to provide factual information and to help you in your decision making and in your conversations with your friends and your family, any women in your lives, as we sort of continue our journey through the pandemic. As our COVID numbers rise again, and from the increasing number of variants that we see, our health is increasingly tied to each other's, meaning our choices impact those around us. That's the concept behind herd immunity. And so we're going to slow down today. That's why we have a nice, generous time slot. Everyone's relaxed. I have some paper in front of me. We have some water, and we're going to work through this. We're going to talk about the facts as we know them and talk about why our herd immunity and our ability to decide for ourselves to take the vaccine has impacts for ourselves, our family, but also the children who can't receive vaccine yet, and individuals who have healthcare conditions so that they can't get vaccinated yet. Meaning that if we achieve herd immunity, meaning enough of us are vaccinated, we then buffer the spread of infection so that we help protect others. That's sort of what being part of the herd is about. Another idea I heard recently, and in preparation for today, is that trying to be focused on our terminology, meaning we'll stick with the facts, but we're also going to try to pace ourselves and think about things together and in words that we all understand. I think because so much attention has been pulled into the vaccine, and because we're all experiencing this scientific journey in real time, we tend to get information from different places than normal. Meaning perhaps you listen to your doctor, but then you read on social media and maybe it changes your mind, right? That there's a lot of different information coming from different venues. And so we want to be careful and direct you to the best resources so that you can work through factual information. We also want to be careful with those that we listen to. So part of this is making our healthcare teammates available through a series of Facebook Lives so that we can give you information, hopefully from sources you trust, or at least direct you to sort of a multitude of other sources. I heard the parallel that I heard was a lot of us, when I take my car into the mechanic, I might say, oh, I think it's something with the starter. I hope you all know that I had to literally Google examples, starter, spark plugs. I might know those words, but I don't really know what they mean, and I don't know if it has anything to do with the problem that my car is having. Meaning, some of us may hear things from sources, and it's sort of that concept of, oh, you knew the words. They knew the words. They must know what they're talking about. Remember, that's not always the case. Okay, so with that being said, thank you. That was the end of my soapbox. The first question that I was sort of handed was kind of the overall view of how has the COVID-19 vaccine impacted pregnancy? And it was sort of the opportunity to kind of share available data so far. I think that's, one of our big purposes in this conversation is to work through vaccine and pregnancy. And then as we go through this conversation, we'll sort of gear off and move to postpartum, meaning lactation and breastfeeding. And then we'll also work the other spectrum of some of those concerns about infertility and menstruation. So the COVID-19 vaccine has been given so far in, I wrote it down, 130,435 pregnant women. So I'm going to say that number again. As of July 6th, 130,435 pregnant women have received a COVID vaccine through a multitude of sources. So the CDC, the different companies that manufacture the vaccine, so meaning Moderna, Pfizer, and Johnson & Johnson, they're all following their individuals who have received vaccine through different reporting mechanisms. So there are some that are patient reported, and so those are called, that's called VAERS, VAERS. And so that's available through the CDC. You could just open your webpage, go to Google, and type in VAERS. And so please go to VAERS. It is one of the reporting systems. Also, vSafe. So for those of you who might have someone or know someone who got their vaccine through UT Medical Center, you were given the opportunity to follow along in the vSafe program, meaning they just texted your phone and said, how are you? What were your symptoms? How are you feeling? And checked in on a periodic basis. So through those types of mechanisms, we have available data from those vaccine recipients. So this, the data that we're talking about right now was published in the New England Journal of Medicine. And so...
One quick question.
I'm sorry, Lance has a question.
Is that 130,000 nationwide?
Right, so it's actually from a New England Journal. I don't know if you heard Lance's question, but he was clarifying is that nationwide. And so yes, I'm actually referencing you to a specific publication that was in the New England Journal of Medication, New England Journal of Medicine. So a great resource for all of us. And they reviewed the 130,000 pregnant women who had gotten the vaccine. When we look at those women who got the vaccine, a lot of the questions that follow talk about what about trimester. And so let's look at the people who have been vaccinated and we have outcomes on. So of those, about 30% received vaccine in the first trimester. About 43% got vaccine in the second trimester, and about 25% got vaccine in the third trimester. So I would feel like that's a pretty even spread. When we look at those women, there were no specific safety concerns in their pregnancies. They didn't have any specific concerns with after delivery with their neonates. In fact, the only reported issues were the side effects, meaning the local and systemic reactions, like I had a sore arm, I felt achy, I had a low-grade fever. Absolutely, right? A lot of us did. I did. My children did. I have two teenagers, 3 children. One can't get the vaccine because he's too young, and the other 2 have already gotten their vaccine. And so we, as a family, my husband too, by the way, he would shoot me if I didn't mention that. He's not a fan of shots. So anyway, he was in line very early. So we all got our vaccines, and we talked about it as a family. So that's one of the things that absolutely, if you've been vaccinated and your significant other is pregnant, then talk about it, right? So again, first trimester, second trimester, and third trimester have all received vaccine during those times, and there were no birth defects found among those women. There were no problems other than the fevers and chills and the aches that we know go with COVID vaccination. And so you may see that, just to apply a term to that, so that's called reactogenicity, meaning how reactogenic, meaning what are my reactions from the vaccine, and then they're usually graded local versus systemic, and so those are pretty similar. And in that publication, there's a nice comparison to flu vaccine. So just to sort of help us as we experience and talk about it as a community, the reactions are a little bit more than flu vaccine. So please expect that and know that that's normal. There were some concerns about, is there any increase in risk of miscarriage? So that's caught a lot of attention, as it should, but it's also one of the key challenges in studying maternal immunization. So a topic near and dear to my heart. I will fully disclose my bias. I do love talking about maternal immunization, but it's a challenging topic, right? Because anytime, as a reproductive woman, anytime we have a loss, we're looking for reasons. When are we most likely to have a loss? It's unfortunately the first trimester, right? Our rate of miscarriage is always highest in the first trimester. And so the rate of miscarriage among women who got the vaccine or any therapeutic that's being studied is challenging to interpret, because you're also trying to interpret the background rate of miscarriage. bear in mind, there are also some changes in a pandemic year, right? That we know that there's a slightly higher risk of sort of systemic reactions and from the virus itself. So if we compare risk of vaccine versus risk of virus, there's actually a lot more data showing that we have far greater systemic reaction from the illness itself than we do to the receipt of the vaccine. I think that takes us in sort of nicely into question number 2. Lance, am I okay to go on to the second one?
Absolutely.
All right, so the second one is, what are the current statistics and trends of those who are vaccinated versus those who are unvaccinated? Thank you so much for this question. It's an awesome opportunity to sort of review the data of, what do we look like for the last year and a half? What does COVID in pregnancy look like? So we'll sort of talk about those unvaccinated ones first. So again, reviewing, what are the outcomes of women who did not receive the vaccine and were pregnant? Thankfully, again, all scientific facts, so we're so fortunate because pregnant women are, for the most part, young, healthy women, and over 90% of them recover from COVID illness in looking at the last year and a half without hospitalization. So over 90% recover from illness without a hospitalization. The mortality, meaning the death rate, so morbidity is risk of side effects, mortality would be risk of death. So thankfully the risk of death from COVID in pregnancy is still less than 1%. So it's about 0.4 to 0.8%, a small fraction. But guess what? When we compare pregnant women with COVID to their same age counterpart, non-pregnant women with COVID, the pregnant women do more. That was about to be a real Tennessee double negative. The pregnant women do not do as well. So compared to their counterparts who are not pregnant, they have an increased risk, a 3-fold risk of an ICU admission. And forgive me if I'm looking down, I don't want to get anything wrong. A nearly 3-fold risk of needing to be intubated, meaning a breathing tube, and be supported with a breathing machine. They're more likely to need maternal bypass, so mom bypass to sort of sustain our circulation and keep everything working. And that's a 2.5-fold increased risk compared to a non-pregnant counterpart. And the risk of death, albeit low, is double among pregnant women with COVID compared to non-pregnant women with COVID. That's to me, those are sobering numbers. So I feel like there are a couple questions that filter through about what's the risk, what's the long-term effects of the vaccine. I think I would answer back that we should be cognizant, we need to know the limitations of the data, but I think I'm actually more concerned about what are the long-term effects of COVID infection. That we're gathering more data that's problematic than we are that the receipt of the vaccine is problematic. So when we're still in the question about vaccinated and unvaccinated and how do people do, so if I'll continue to walk down the unvaccinated pathway, let's talk about, not just because pregnancy is 2 people, right? It's the mommy and her passenger. So how do their babies do, and how are their obstetric outcomes, if you will, meaning what are their events or complications that are pregnancy related? So pregnant women with COVID have a higher rate of stillbirth. So earlier we were kind of mentioning that idea of that systemic inflammatory process, and that does appear to be associated with increased risk for stillborn. So in a lot of the major pandemics of the past where we have recorded data, there generally tends to be a slightly higher background rate of stillbirth during those times, and the COVID pandemic is no exception. But women with COVID infection tend to have higher rates of stillborn infant. Now, there might be things that confuse that data, right? Bare facts, all honesty, full transparency. So maybe that's because we had more disruptions in care, right? When during this shutdown, a lot of us were afraid to come in and be seen. So maybe the higher rate of stillborn among women who are pregnant and get COVID, maybe that's because they were later took care. Maybe that's because they came in later and they were sicker. Maybe that's attributed and correlated with higher rates of stillbirth, that they didn't want to come in, and so they had a higher rate of, maybe going further with a little less surveillance and intervention. Pregnant women who have had COVID and were included in studies so far also have a higher rate of preterm birth. So that seems to be highest among women with severe illness. Now, so we've talked about two things: higher rate of stillbirth, higher rate of preterm birth. Now, the good news is generally their infants are generally born in good condition, that there doesn't seem to be a correlation between the severity of maternal illness and how our baby is doing. The challenging part of this discussion, and we talk about it, in the office seeing patients, from time to time people will come in and ask, originally we thought that the rate of congenital infection, meaning from mother to child prior to delivery, we thought that was 0, but it's actually not. So the rate of mother to child transmission with COVID infection is not 0. As a mom, when I think about some of those consequences and sequelae of COVID infection, I really begin to process and compare what are those risks of COVID vaccination again, right? So now I'm going back to thinking about, okay, so now I know 130,000 women have gotten the vaccine, that they've had no increased risk in adverse outcomes of pregnancy issues, just a local fever and malaise. And how does that compare with increased risk if I don't do vaccine and I do get ill from COVID? How does that compare with the rate of stillbirth and preterm birth? Again, just facts. The next question I have would be, let's see, how does the vaccine protect against the Delta variant? Super fantastic question, right? I actually got asked this poolside just the other day. We were sort of having a conversation outdoors about, so what is this like? Are we really seeing an increase in numbers? And what do we think of the Delta variant? And so yes, we are seeing increased numbers. Yes, we should be concerned about sort of this resurgence and the transmission of the Delta variant. Let's think about that for just 1 second. So the original viral strain for COVID-19, looking back at kind of the accuracy, originally there was a lot of confusion about how much infection came from how much, if I get COVID and I have a normal course, how many people might I infect? So the answer to that was, in looking back with the original strain, was that I might infect about 2 to 3 people. With the Alpha variant, so we haven't heard much about that, but the Alpha variant actually, so they're named, in order. The Alpha variant was 60% more transmissible. From that, the Delta variant is 60% more transmissible than the Alpha variant, not the original. What that translates to is, if I get COVID infection, now my usual course with the Delta variant would be to infect 6 to 7 people. Now, if we think back to our herd immunity, we're really begin to transmit to more and more people. So the good news is that vaccination is highly effective against severe disease, but it's not preventing all illness. Again, so with the Delta variant, our vaccine minimizes the risk of severe disease. It doesn't totally prevent illness. I heard a great comparison for this, and I really like it. So it's my new swing thought. So if the vaccine is compared to the seatbelt that I click when I get into the car, my mask is actually my airbag, right? So vaccine is my seatbelt, my mask is the airbag. So it's going to take both mechanisms for a while. So that's not the news we want to hear, but facts are facts. We're all sort of on the journey together. I think the next one is the COVID vaccine safe if I'm pregnant and wanting to get pregnant? So hopefully we've sort of worked through if I'm pregnant. The other thing that I didn't mention yet, but this raises a great time to do so, is that when we think about kind of the regulatory agencies that are nationwide that pass out guidelines. So for us as obstetricians and gynecologists, ACOG, so the American College of Obstetricians and Gynecologists, is one such governing body. and the Society for Maternal Fetal Medicine. That's a mouthful. Anyway, my family was sort of scratched their head when I said I was going into maternal fetal medicine and went, wait, what? It's a mouthful. Anyway, so there's a whole group of us, obviously, who take care of high-risk pregnancy, and it's our Society of Maternal Fetal Medicine. So SMFM and ACOG on July 30th, so that's just a few days ago, came out with a formal statement recommending the vaccine in pregnancy. Now that's a huge stance. That's a big change. We've gone from saying, well, you know, we acknowledge that studies were not done in pregnant women. So a prior video we did in this setting, we sort of talked through some of that initial data. And the recommendation at the time was you should have the conversation with your provider. You should think about what's your job exposure and how, you know, weigh that with the risks and benefits of the vaccine. Now, we've moved based on the safety data so far. Everyone is very satisfied, and we continue to have positive affirmation that there's no adverse consequences to getting the vaccine in pregnancy. And with that being said, the formal recommendation is to get your COVID vaccine if you're pregnant. Now, we didn't talk about wanting to get pregnant. So remember, if you happen to go to that New England Journal of Medicine article, with the original 130,000, 2% of those were actually recorded as getting their vaccine periconception. So it's hard to kind of track that period of before pregnancy. To me, that kind of goes into some of the data of, does it affect fertility? Does it affect, you know, are there any adverse effects in terms of menstruation? Anything else that would weigh in from the vaccine? We're thankful to our colleagues in reproductive endocrinology. From them, we've learned that we'll first talk animal studies, that there's no accumulation of vaccine in rat ovaries. So rats being a correlate for other human models, but a little bit more able to sort of take them out, of course, and examine. In studies that are published, there's no evidence of vaccine in animal model ovaries. So the next step is there's no harm in pregnant animals. So of the animals in animal studies that got the vaccine, there's no harm in the animal or any change in their ovaries. Moving into humans, there's no negative effect from the vaccine on ovulation when the ovaries are stimulated for IVF or fertility treatments. So they were able to sort of use those moments as time to evaluate a woman's ovaries because they're already there to retrieve an egg, right? So it's an able time to sort of get some valuable data to answer some of these questions and myths that are circulating. So we also found out that there was no negative effect on implantation of the embryo during IVF among women who are vaccinated. There's no negative impact on sperm of men who have received the COVID vaccine. Isn't this nice that our reproductive endocrinologists, you know, were able to capture this data, you know, during ongoing real-time treatment of IVF and fertility assistance? But by research volunteers, they got a little bit of an extra sample and can say, no change in sperm, no change in ovulation, no change in implantation of an embryo, and then finally no negative effects on miscarriage were seen at all. And then we know, so that sort of goes from the periconception, and then we roll into the pregnancy. So we're sort of back to where we were talking about to begin with. The next question I have is, what advice should I pause? Like, are there any other questions that we should answer within those, or do you want to get them at the end?
We'll get those at the end.
Okay, that sounds great.
Yep.
Okay, so what advice would you share with a woman who is hesitant to get the vaccine? I think that's hard. You know, the COVID vaccine, like a lot of vaccines in general, some of us feel very strongly one way or the other. And I think there's a very careful line between having respect for each other's choices, for ourselves and our family, and we want to remain respectful, that we're not trying to sort of infringe on anyone's individual choices. But we do want to share data. And for the people, you know, we sort of have the yes, I'm going to get a vaccine the day it came out group, and we have the no, I'm not going to get a vaccine really ever group, and that's okay. But what we want to influence is the group in the middle that is looking for data. We want to, again, going back, giving you good sources to go after that information. So if I were, when I'm asked about a woman who is asking about the vaccine, I think it helps that SMFM and ACOG now say, yes, we should recommend the vaccine. That yes, it makes a difference when we as doctors and providers, midwives, advanced practice providers, anytime we talk to our patients and have the conversation, we appreciate you bringing it up. We know it sort of, sometimes it's things we're thinking about that we hate to voice. And so we want to encourage you to think about that, yes, that there's, so available safety data are out there. You're right, we don't have 10 years worth of data. I think that's something that sort of comes up as we go down in the questions. And someone said, are there any, it says, how does anyone know the potentially long-term effects on an unborn child or a mother's fertility or any reproductive organs? So we know the available data from research so far. But we're not here to try to say that we have 10 years worth of data, because we don't. But we do see that there's increased risk of getting COVID infection. So if I could, when we say, look at the number of people out there in the cardiology population or in that you have seen in your lives who got really sick with COVID. When we compare illness and sort of longer term and critical illness and death from COVID, I don't know that that holds a candle to my theoretical concerns, of which none have been validated so far, about getting the vaccine. So I would send you a very strong message about encourage. Vaccine versus illness. Even vaccinated ill is going to do far better than unvaccinated ill. So to some degree, it's my pleasure to get my vaccine and to put it on my badge and to tell you about it. It's my pleasure to wear my mask. All of those things contribute. So let's see. There's another question about, does the vaccine affect fertility or future pregnancies, and has there been enough time to know the answer? Hopefully our talk about the information in the infertility trials helps with some of that. That no, we have no reason. In fact, the original study that this came from, we are all aware that there are influencers out there, both in any direction, right? So anyone, but there are successful individuals who kind of get that message out there. And so it seems as though during this, one of the big myths that started early was about that infertility. If you really dig deep and go back in the scientific data, that original publication was actually a very small study. It was from the 1980s. And it was never reproduced. And so it was looking at sort of a correlate of a vaccine that wasn't necessarily an mRNA vaccine. And so I think it just really ended up on a lot of social media pages, and all of a sudden perception became reality. So please go back, think about my car mechanic example, right? Just because I say it might be my starter or my spark plugs, I really don't know. And so make sure that the individual you're getting information from is backing up their data in a good, reliable resource. So we would direct you to the CDC's webpage. We would direct you to our home pages. We would direct you to, for women's health, ACOG, SMFM. If we go to those pages, interestingly, they're all aligned. So you're not getting conflicting data from the recommendations that are coming from the medical bodies. So.
And just off of that, you wanted to mention the TIP-Q.
Oh, absolutely. So, I'm sorry, that is one of the last ones. Thank you, Lance.
I shared those links in there. So.
Great. Okay, so there are links posted. So the statewide organization, so it's called TIPQC is the way you say the acronym. So basically it's a perinatal quality collaboration. So we link the state, and everyone sort of tries to look at infant and perinatal, meaning mother-baby outcomes. And one of the things that we focused on, or that they have focused on during the months of July, were to review COVID in pregnancy, COVID vaccine in pregnancy. And so they pulled experts from across our state, from East Tennessee to West Tennessee, to talk about it. So there's a series, if you'd like, that is additional information. They're recorded webinars. One of them is even from a pediatrics infectious disease specialist. So I think that provides sort of a nice balanced view from a variety of resources. And so they did a really nice job, and just wanted to make that those talks available for you all as well. So again, we appreciate your time and interest, and so those are listed whenever you'd like to pull them up. Let's see, we have one. My next one down, I was sort of the third one down there. I've been fully vaccinated since April, and I'm now 3 months pregnant. Should I wear a mask or not? I'm so confused. It's a really difficult and a very charged discussion right now, isn't it? So again, I'm going to default to the idea that vaccines are our seatbelts and our masks are our airbags. So while our vaccine is fantastic and it is getting us, helping reduce our risk of hospitalization and death, it doesn't mean it's zero. And so as our community prevalence increases of circulating disease, again, herd immunity, as our incidence rises, with our current vaccine rates, it's very challenging. And with the Delta variant and its infectivity, we often will need our mask in addition. I have one that says, how safe is it to get the vaccine at 36 weeks? I'm quarantined always, so I have a low risk of getting COVID, and so it's just sort of someone thinking through and asking about, you know, what's the chance of infection, and should I go ahead and get the vaccine or not if I have a low risk of exposure? I think there's a couple questions in there, and so I'll take them one at a time. So how safe is it to get vaccinated at 36 weeks? Absolutely. You know, if it makes you feel better to wait until the third trimester. I think there's also one of the next questions is, what stage in pregnancy should I get the vaccine? From the data we have so far, it's very evenly spread between first, second, and third trimester. Again, it was like 30%, 40%, 25%, so pretty evenly spread by trimester, with no significant increased risk reported, other than local reaction and just like fever and malaise. So that then comes down to, so if there's no increased risk, then how do I get the most benefit? So awesome thought. Scientists, nerd alert, I'll go ahead and push up my glasses there. As we think about the benefits of vaccination in pregnancy, it is a very cool gift that as mothers, we make antibodies, and we give those antibodies across the placenta as a little gift to our newborn. And those last and protect our baby for the first 3 months of their life when their immune system can't make antibodies yet. And so it is a beautiful gift. And so if I'm thinking about the COVID vaccine and getting the most out of it, technically speaking, I want there to be enough time between my receipt of the vaccine and my child's delivery for me to make antibodies, have them increase in number enough that they go across into that placental circulation over into my newborn, or into my fetus, about to become my baby. So that process takes about 2 weeks. So if you would like to wait until 36 weeks, that's awesome. Please stay pregnant until you're 38 weeks to give your baby the most benefit. You know, and we know those data from both the Tdap vaccine, or the whooping cough vaccine that's recommended in every pregnancy, and the flu vaccine that's recommended in every pregnancy. So from flu studies and Tdap or whooping cough vaccine studies, we do know that giving the vaccine around 26 weeks and on, like kind of that window, it's approved, Tdap is approved 20 weeks until kind of end of pregnancy, but the ideal window of giving the gift of antibodies and the protection to our newborn seems to be around that 26 to like 34 week point. But 36 weeks, please, yes, you go. It's still going to benefit you. Then the next question was, I'm worried about a hospital stay and if there's a chance of infection from doctor to patient. Guess what? This is what we wear all day long. And so, in fact, I'm going to keep my germs, so I wear a mask to protect you. I wear a mask to protect me. So please don't forget that we're all doing in the hospital. You'll find all of us masked. So we don't want you to be hesitant to walk in the doors. We don't want you to stay away. Come back, come in. We want you to feel very safe. Remember, we've been wearing mask and face shield and protection since the beginning of the pandemic. And so even during the time of shutdown, when our cases weren't that high, we didn't know a lot. But guess what? So many of us never got COVID in the hospital from work exposures, right? I've taken care of a number of patients with COVID and have not had a COVID infection. I don't know if I'm supposed to share my own health information, but I guess if it's mine, I can share it. Masks work. So please come in. Don't hesitate. And then let's see, also if you, so this person's sort of talking more about worried about how it will affect baby and chance for SIDS. So there's no reported information correlating vaccines with SIDS. There's no strong link, or there's no links there that I'm aware of. Just like anything, we can probably find some small obscure studies that hold up pretty much about any perspective you'd like to have. And so that's why we want you to be careful where you get your information from. That if there are things that are rare that you see, go look or go talk to your provider about it. The chances are that a lot of that wasn't continued and perpetuated, that it didn't hold up in other studies. So let's see, I think we answered that one about what trimester would we recommend it. And we said based on Tdap and flu, it's safe in first, second, or third. Please, if you're at risk and as our cases increase, get it now. Don't delay. You're going to help yourself, and you're going to continue to give the gift to your newborn. So please get the vaccine. Will COVID vaccine increase the chance of miscarriage? I think we talked about that one in case you're joining us later. I'll just briefly restate and say anytime we study any event, any exposure in the first trimester, we find miscarriages, and a lot of that is because we understand so little about why miscarriages happen. And so it is a part of our human reproduction. It is most common in the first trimester. And so anytime we study any intervention, we have to acknowledge there's a normal background rate. Was it associated with receipt of the new medication, the illness, the whatever? It's hard to say, right? I wish we knew more about miscarriage and could answer that, but no, there's no increased risk based on getting the vaccine. So, how does anyone know the potential long-term effects of an unborn child or mother's fertility or any reproductive organs? We're not trying to say we have long-term data, although this is sort of a chance to talk a little bit more about some of the specific vaccines and their mechanisms. And so that would be kind of to address the Pfizer and the Moderna of both being messenger RNA vaccines. So remember, the vaccine is designed to put in a piece of genetic material that codes for a protein only. So they're not giving you virus. They're not giving you a whole other subset of, genetic material that's going to go anywhere into my DNA or any of my genetic material. It doesn't at all. In fact, it goes in and then my body's immune system sees it, takes it to my own body's little machinery or my protein manufacturing plants, also known as different organs in the cells. Anyway, so the point is it then uses my own body's machine to crank out that same protein. So it's just going to transcribe it, makes the little protein, and then the protein my immune system sees that protein, recognizes it as foreign, and then all of a sudden I've made an antibody. So it's pretty awesome that I didn't actually get a piece of anything that was a live virus or a modified virus or a virus that's sort of been broken apart and has little proteins of it. It's not. It's super cool. It's literally just the genetic instructions for the protein. My own body makes the protein, that genetic instruction is degraded, and then I start making the antibody to attack it, so that then I walk around and say, oh, I know that foreign protein, and I'll recognize it any day. So the messenger RNA vaccines have been in progress for a while. And so have they been studied in pregnant women for a long time? No, they haven't. We wish we could tell you so, but it's not. The AstraZeneca vaccine, though, is the same. It's not an mRNA one, and it's the same platform as the Ebola vaccine, which has been studied in pregnant women. And if you all remember, I think the Ebola, I'm going to go beyond my scope of what I should say in recorded history. But anyway, the Ebola scare was certainly more than 5 years ago. I feel like it was around 2012 or 13, maybe 14. And during those times, so ever since then, we've been working on pandemic preparedness. And so that vaccine has been in vaccine trials much longer. And there are no adverse events reported in that study population. Lance has some thoughts, so hopefully we'll...
One question, because I know we're getting close to your time, but
yes, sir.
It's timely because it's World Breastfeeding Week, so we had a question about what about breastfeeding? So I guess assuming she hasn't been vaccinated, but is now breastfeeding. So what were your thoughts?
That's awesome. So if you all didn't hear that, Lance was sort of conveying the question about breastfeeding. He also gave a shout out for World Breastfeeding Week. So super excited and glad to honor all of the work that our moms are doing to help nourish their babies. So we talked about the gift of vaccine and pregnancy, that we make the antibodies and moms give those antibodies as a gift to our babies. Well, we also know that part of the purpose of breastfeeding is that we do make those antibodies, and those antibodies go through in our breast milk. Now, those data are a little bit harder to study because I'm taking an antibody that's in mom's bloodstream, putting it into her milk, and then it goes from mom's milk into infant, mouth, right? So then it's what's called mucosal immunity. So meaning the neonate is taking that in through their gut and then absorbing that antibody, and then is there a direct transfer to their bloodstream? No. There is a transfer, but it's not at an equal rate. So meaning it's going to take a higher concentration of antibodies in our breast milk, we think, to help our neonate have a similar serum concentration. But guess what? It's worked for thousands, depending on where your beliefs are, millions of years. So we know that there's good data behind breastfeeding, passing antibodies and protection to our babies. So if you deferred your vaccine during pregnancy, guess what? Please ask. You can probably get your vaccine on the way out the door. If you deliver your baby here at UT Medical Center, you can certainly get your vaccine on the way out the door. And so your breast milk, by the time we need about 2 weeks to boost that titer. And in that time, your breast milk, as it's still the end of that beautiful colostrum, you're passing all of that antibody on to your baby as well. So there are no untoward events of getting the vaccine and any risk to baby. Remember, the majority of vaccines don't have anything other than genetic material that's degraded. So of course it would not be in our milk. So thank you, Lance.
Yeah.
Any other thoughts?
I think you covered it.
Okay. Anything else that's been chatted in?
No, there's some other questions that we can try to work with you offline.
Okay, great. So we'll answer other questions offline. We'll do our best to sort of get back to you. We can't thank you enough for your attention and your enthusiasm and your interest. We know that all of us sort of have very diverse, and we're coming from different places. Our job is to give you facts and information and help you make your choice with your healthcare provider. Again, as of July 30th, SMFM and ACOG recommend the COVID vaccine in pregnancy. So if this doesn't apply to you, please pass the word. So help us communicate that message out. Remember, our vaccine is our safety belt. Our mask is our airbag. So lean into that. Don't resist. None of us really want to be necessarily wearing our masks, but we'll do what it takes to help protect you and to help protect ourselves and to help protect others. We're all in this together. So please enjoy Please enjoy the rest of your day. Thank you for your time, and please tune in for additional series in this sort of this lineup this week and this month from UT Medical Center regarding COVID vaccine. Have a great day.